All right, so let's look at Paul, where we're going to start in the beginning, try to uncover some of the diagnosis and thought process, look at bracket selection. In Paul's case, we actually used a really great typical class 2 variable torque protocol where we're using procline to counteract the retroclination force of class 2 elastics. And what you're really going to find is as we move through these phases and we started progressing, Paul, his class 2 started correcting, he was wearing his rubber bands, and really we'll highlight the aesthetics at the end that show that this case was treated in such a great way in a very short period of time. Now, again, we go through this a lot deeper in the course. We spend about 15 to 20 minutes really breaking down exactly what we did, but really if you spend some time and you just kind of pause and start, you'll really see what we were able to accomplish with archwire changes and duration of time. So thanks a lot. Hopefully you enjoy. This is Paul. Paul came in with a chief concern of crooked teeth and a pretty good overbite. So we were able to take care of this young man in about 13 months and treat all of his concerns. So let's dig in and show you how we did it. So like all case starts, the most important thing is to start on the right foot. So we want to make sure that we have a really good case plan and case setup. So we'll dive into his initial records. We'll give you a comprehensive aesthetic diagnosis, go through some variable torque selections, and kind of just give you a highlight reel on where we place the brackets. So when we look at his case, we can see that he's constricted in the upper. He's got a class 2 division 1 right and left and a little bit of a blocked out canine with a little bit of an increased curve speed. X-rays really show nothing that's too contributory, and his Ceph just verifies the class 2 with fairly well positioned incisors. So his comprehensive aesthetic diagnosis is really treating the class 2 div 1, creating space for the canine, developing the upper arch, and making sure that we take care of all the mini and micro aesthetics in this case. So now in his case, since he's a class 2 and has some arch development, we chose procline to prevent retroclination from the class 2 elastics. And then in the lower, we chose procline on the lower 3 since they were lingually inclined, and then retro on the lower 2 to 2 to essentially prevent proclination due to class 2 elastics and arch leveling. Like all cases, we're placing these right at FA, upper centrals at 5.5, laterals at 5, canines at 5, and then in the lower, we place the canines at 5.5 and the lower incisors at 4.5. Great, so from beginning to end, you can see that we're able to take care of this young man, treat all of the conditions that we needed, develop a beautiful smile, great class 1 occlusion we achieved. So let's go ahead and dig into how we did it in a simple way. Obviously, we go through this in full detail in our case presentations, but I'm just giving you guys a highlight reel. Started with 0-4, waited for the tooth to come in, bonded it, added the 0-8, went to our 140275 for 8 weeks, and we kind of had class 2 elastics running on this kid from the beginning, just 2 ounces right and left. And here's where we were able to get. You can see that only after 6.5 months, we're able to develop the upper arch, derotate the upper molars, upright the lower buccal segments. We even attained a lot of space in the upper, which we went ahead and closed on this 140275 wire. So phase 2 is about 3 months later. This is after we placed our full expression arch wire. So you can see we went ahead and placed an 180275 copper nitide upper and lower, C-chained under the wire to make sure that we closed up that space, increased our elastics to 3.5 ounces, which is a rabbit, and then we did a repositioning appointment in the middle. So you can see at the end of phase 2, looking really solid. Arch development looks great. Lower buccal segments look upright. His smile's starting to dial in nicely as far as smile arc, but we do have a few more things to touch up. Phase 3, we put in steel wires. We just basically replaced the 180275 nitide with stainless steel, 160275 stainless steel in the lower, and then continued class 2 elastics. So you can see that we ran class 2 elastics throughout this treatment. Really, phase 3 records are taken 1 week before debond, just so that we can get everything dialed in, document where we are so that we know where we were finishing when the case was debonded. A week later, a young man comes in, we take the braces off, and in all of our cases, we take our records the day after debond when they come in to get their retainers. So 13 months, 9 appointments, you can see the sequence, pretty typical and very streamlined. If we go ahead and we look at his final x-ray, everything looks great. A little bit too much distal tip on the canine, but that's just because of my bracket placement. I've went ahead and resolved those issues. But look at his numbers. I mean, with class 2 elastics and what we really had to start with, I mean, this system shines here, and it just shows that we can really create a nice protective couple as long as we're not overpowering the system, hence the 3.5 elastics. We look at arch development. Really, we kind of started out pretty narrow, some constriction in the lower, and really coming out of phase 1, you see the power of the system, and then we were able to maintain it through phase 2 and phase 3. Everything looks really nice. Lateral progressive smile transformation. You can see he wasn't super thrilled about braces, but the young man was amazing. He did what he needed to do and got to the end in a really reasonable amount of time, in just 13 months. Macro aesthetics look good, mini aesthetics look great, and his micro aesthetics are super dialed in. Pretty much what we always see with Ultima, seeing though we have 3D control of all the anterior teeth. We can see right here from the archwire close-up, it looks like I made one bend at the end, which I did. You can see the upper left central needed to kind of come down in the mesial, and we did that with 1 week before debond. So really, overall treatment statistics, 13 months, 9 visits, only one archwire bend, and a couple broken brackets. And I really do find that this really is a great example of how class 2s can be treated in a reasonable amount of time, as long as we have a patient who participates. Hopefully you enjoyed this case. Again, if you're interested in this type of treatment, continue to check us out at the ultimateorthodonticacademy.com. Follow our socials. We have a mission of providing some amazing content for anybody who's interested in increasing their level of orthodontic care. So talk to you guys soon, and until next case, bye-bye.